Painsense is integrated into service delivery and into people's lives in important ways.
We take apps like Painsense, which is for the management of persistent pain, and connect them into clinical systems and host them in secure N3 environments. We kind of aggregate all that information and all those offerings and take them to NHS organisations and sell those services to them.
In Leeds, it's integrated into a complete new approach to how people with chronic pain are supported by the service. A biomedical model, which is really scans and pills, if you like, to providing much more support for self-management.
As a user of the service, I think it's really great because you're enabling people to look after their own condition. So rather than you going to the doctor and the doctor saying, oh, you've got this really complex condition and you don't understand it and this is what you have to do to manage it. You're saying, here's an app, it'll tell you loads of information about your condition, it'll teach you how to manage it yourself, and it empowers people to look after their own condition.
And Painsense is part of the resources, one of the resources that's provided by Leeds now to help make that shift to looking after the whole person, emotional, psychological support, as well as looking for physical problems and providing medications.
The app itself is really, really good. It's based on two different recognised pieces of work. One is called the Pain Management Plan and one is called the Pain Toolkit. Both written by different people. I think both of them are expert patients in the area. So they're recognised pieces of work which were already in use in the management of persistent pain. So they've got a good history of innovation. I think the very kind of foundation of their business is kind of consultation, research and development of innovative services. So they're really moving forwards, and I think they're probably one of the only companies in the UK that's managed to take an app from kind of a theory through to implementation. So, going from saying, oh, we've got this amazing healthcare app and it does all this and that, to actually integrating it into a care pathway that can be sold to an NHS organisation is quite significant. So they've really achieved something there.
That information can be securely shared with healthcare professionals automatically by the system and can be picked up, for example, by a GP at the next appointment or by a physiotherapy or an MSK service, so that the information isn't lost and that history can be seen by the healthcare professional. And members of the public know that their information can be looked at and can be shared with everybody who's concerned with their care.
So they've done really well to get it integrated into an NHS care pathway, and I think in Leeds West CCG there's 160 different practices now, GP practices, which are using the app. Nearly 1,000 clinicians that are all, when patients come in for the first time complaining of persistent back pain, they're referred onto the app and certain a way to use it. So it's really significant to digitise the care pathway in that sense, and they've done an evaluation as well, which I think is going to be released very shortly. So, the outcomes in that evaluation are going to be really quite significant as well in terms of cost savings and efficiencies. So it's a really compelling argument, and it's a really positive thing for the future.